Sister Araceli, and she, also serves the community in a different way, and advocates for others and supports and actually takes care of others. So she's the one that kind of instilled this in us and said, if we are here today and we're advocating, and Juana's advocating for herself, and we're advocating for others, why can't we help support and empower others to actually do the same? Because it's like a ripple effect, right? Everything that you do can cause that ripple effect, and you can empower others in the phases that they're at. So Looms for Lupus does that. We support those that live with lupus, overlapping conditions, and with autoimmune conditions like lupus, they bundle up. So most likely, if you have lupus, you're going to have a couple other autoimmune and other chronic conditions, including fibromyalgia and mental health. So what we do is we support, we empower, and we advocate, and we provide the education needed for those people that need to learn how to relieve stress, learn how to feel empowered, right? So it's been pretty amazing, and we've been facilitating for since 2011, right,
Right,
sister?
right. It's been a while. It's already been 11 years. 11
Yes,
years
and
that
the
we
amazing.
started, and we're happy to continue not only to advocate but also to learn, to educate, or bring information to our community.
Yes, definitely. And if you've noticed, this is a joint effort between Looms for Lupus and Mata Advocacy and Support. And you might think, what does this mean? What are these two organizations? Well, they are two very different, separate organizations. One of them is a nonprofit, and we, Looms for Lupus,
Mhm.
will continue to do everything that we are doing. But also with Mata Advocacy and Support, what we realized is with Looms for Lupus, a lot of people would just see us as disease specific. And I will touch a little bit about that in a little bit. So you can advocate for yourself, right? Which is self advocacy. You can
Right,
advocate for a specific disease like lupus, but you can
right.
also advocate for more than just lupus or a condition or fibromyalgia or mental health. You can be an advocate for so many other things. And one of the
Mhm.
things that we realized is we have been doing more, and more in Spanish translates into más, right? And that's where MAS, which is Mata Advocacy and Support, was born, with the help of our amazing friend, Molly McCabe, who is also a patient advocate, and that has supported us with this journey. Mata Advocacy and Support is an organization whose consultants, who, it's us, we advocate, support, and make a positive impact in the community through collaborative healthcare efforts with local, grassroots, national, and international organizations. And yes, you heard that right. Grassroots, local, grassroots, national, and international organizations. Because believe
Right.
it or not, Looms for Lupus has had the privilege to be able to help other communities besides just local communities here in Baldwin Park, California, where we reside. We've gone a little bit beyond to our local state. We've gone a little bit beyond to national, at the
Mhm.
national level. And we are also supporting, and we cross the borders with international support. So it's been such an amazing journey. And that's why we're here today, because we became advocates, and we know that advocacy is very important
Definitely.
for everyone, right?
Right.
So National Patient Advocacy Day is observed every August 19th. And today is Friday, August 19th, 2022. And what does patient advocacy allow us to do? It allows us to have a voice, to amplify our voice, to be able to ask and get informed about our medical treatments, our procedures, just basically navigating our healthcare journey. And a lot of the patient advocates and patient advocacy organizations and groups that we'll mention a little bit further, what we do is we educate, we support patients, their families
Mhm.
throughout their healthcare journey. So this may mean, navigating your healthcare. This may be introducing you to healthcare literacy, or learning about terminology that you may not have known or understand when you go see your doctor, knowing what kind of health plan you have, and stuff like that. Or simply, like Juana did, is simply use your voice, right, sister?
Absolutely. For me, my voice saved my life. For others, it can be simply getting the right treatments, getting the right medication, or as simple as this doctor's not helping me. Can I move on and get treated by a different doctor? So definitely, self advocacy is important, and it can be many things on how we can self advocate.
Yes. And what really does a patient advocate do, right? Can you become a patient
Mhm.
advocate? So, what does it entail? So, basically, what we're looking at is a patient advocate. Really, all it is a person that helps you navigate through the healthcare
Mhm.
system, that gives you and provides you the resources that you need to be able to get the access to healthcare, to be able to obtain equitable healthcare access. And if you are not getting the healthcare access you need, then making sure that your voice is heard and those inequities are highlighted. And if policy or anything that's already set in place that's preventing you from getting the treatments or the access that you need, then also using your voice to not only raise that concern, but also make change. So that is really, I know that's a lot in one, but what I want you to take away from this is you are the most important person in
Mhm.
all of this patient advocacy effort. Your loved ones, your family members, your community. And self advocacy, what Juana was talking about, is the most important part of a patient advocate. And we want you to know that your voice does matter, that you are not alone, and that you can actually advocate for yourself from the comfort of
Mhm.
your home. You can
Definitely.
advocate for yourself in the doctor's office. You can
Yes.
advocate for yourself by being behind the curtain and saying, you know what, I don't want to share my name. This is my experience. Can you share it for me? Yes, you can be an advocate in many different ways. So one of the things that we talk about when we say self advocacy is really your voice does matter, and using your voice to getting the care that you need, right? um,
Right.
to making sure that when you go to your doctor's office or your doctor's appointment, or your medic, whether it's a specialist or your healthcare provider, that you are being heard. Not that they listen to you, right? But that you're being heard, that
Absolutely.
they understand you, they respect you, and that also you understand them. And that when you guys are, or when you are at a doctor's office, that not only is that mutual understanding, but there's also collaborative effort in getting the treatments that you need. Because at the end of the day, your outcomes, your healthcare outcomes, is really what matter. um, and before we go dive into a little bit deeper, I do want my sister to kind of share, a short snippet of her journey and how she actually became a patient advocate for herself, self advocacy, that night that she was diagnosed with lupus. But before you go to your story, sister, I do want to just kind of bring on a couple of people that are on here that are tuning in. And if you are tuning in, if you just tuned in, put your name on there, say hello, share this this live so others can see it later. Hi, Melissa. Yes, Melissa Nerdy Talwar, one of our friends and patient advocates and community advocate for fibromyalgia. She says your voice matters. Yes, your voice does matter, and your voice is a most important voice. And then, hi, Jessica. She says, big thank you to the Mata Sisters for bringing this critical content and support to the community. Thank you for tuning in as well, Jessica. So please, this is interactive. Let us know if you have any questions. And we'll take it on from here, sister. Tell us a little bit about how you kind of stumbled upon being a healthcare advocate for yourself back in 2009.
Right. Well, thank you so much, sister. Yes, in 2009, I had no idea what a patient advocate was. I didn't even think about that we can self-advocate until I realized that I was self-advocating after I was told at the hospital that I looked fine, that I actually went to the doctor. I wasn't feeling well. I went to urgent care. Doctor said I looked fine. I persisted, and said, hey, I know something is wrong with me. So that's another thing. We have to make sure and pay attention to our body to know, if something is not right, then we need to bring it up to the attention of the doctor. So in my case, yes, I go to the doctor and I tell him that I know something is wrong. Of course, one of the things that he said is that I looked fine, that he didn't think anything was wrong with me. I did show him a couple of my symptoms, one of them being really bad mouth sores, nose sores, and explained about the symptoms and why I felt that something was wrong with me. After insisting and getting a few lab work done, he calls me into the office and he says, yes, in fact, you are critically ill. I was rushed to the emergency room, and 2 hours later, I was in ICU for 7 days. So now I can tell you that if I didn't realize that I was self-advocating until later, I learned that that's exactly what I did. And if I had not advocated for myself in getting the treatment or getting lab work done that day, I would not be here. I would have died, because the problems, the health issues that I was going through were very critical. And if I had gone home that day, like the doctor said, I would not be here today. So yes, that's my story, where I had to advocate and get the treatment, and I'm here because I advocated for myself. Now, later I learned, and as months and weeks and months went by, I realized the importance of speaking up, of being heard, because that literally can save somebody's life. And that was just my story on getting the proper treatment or getting checked. But many others have other problems where they have to speak up, getting the right medications, getting the right treatments. For me, it was just being checked and making sure that I was okay. When I was not, then that's my journey. That's how I started self-advocating, though I can tell you that even before that, that day my life was saved pretty much because of my self-advocacy. But in the past, I was always making sure that I was heard. I was heard not only with different symptoms, but also advocating, to making sure that I was checked. Prior to being diagnosed with lupus in 2009, I had other health problems where I was making sure and going to the doctor, sending emails. Back in 2009, you really didn't hear that, sending emails, communicating with your doctors through emails, but I was able to do that with a medical provider that I had. So I now realize that my advocacy started way before the day I feel my strong advocacy started.
Yes, and if you would not have spoken out that day,
Yes.
it was a normal day. We were actually, I think we were bowling that day. We were bowling,
Yes.
and you kept feeling sick, and your body. So you go to the urgent care, they tell you to go home and to come back the next day.
Right.
But you knew something was wrong, and you
Yes.
definitely said, I am not leaving here until I have an answer. And
Yes.
you did that. And because you did that, because you said, I
Mhm.
know my body, I know
Yes.
there's something wrong with me, you
Yes.
actually were heard. They listened
Mhm.
to you and they
Yes.
were able to provide you the care that you needed, put you
Yes.
in ICU for 7 days, which is probably not everybody's story. But
Right.
the important part here is she is alive today because she advocated for herself. And I
Right.
think that is the message we want
And you don't need to be taken or go to ICU to self-advocate. It could be as simple as, hey, I don't think this medication is working for me. Doctor, hear me out. Please help me in making sure that I'm getting the right dosage, maybe changing medication. It could be, many, many things. It doesn't have to be just a life-threatening situation, but just, being heard by your doctor, being heard by your providers, and making sure that you get the right treatment, right medications.
Exactly. And here are the tips on how you can become the best advocate for yourself and your loved one, right?
Mhm. Right.
First and foremost, like Juana said, don't wait for you to get a diagnosis of
Mhm.
a chronic condition or anything like that to take action. You start taking action today. You start taking action right now. When you go see the doctor, make sure that, if you are diagnosed with a condition, to learn about your condition. Learn about, is this a chronic care? Is this a chronic condition? Is it going to go away? Is it long term? How bad is it? What can you do to help yourself with this condition? Learn about the different treatments there are. Learn about your options. Be part of that care.
Mhm.
Communicate with your providers, talk to them. This is a group
Right.
effort. Remember, they work for you. They work for you. When you go and see them, you go and you pay for your services. So they're there to provide the best service that you need. Um,
Mhm.
Also, prepare for your doctor's visit. So, kind of like Juana said, she knew there was something wrong. So she went in with a list of her symptoms. This is how I'm feeling. This is how long I've been feeling with this. These
Right.
are the questions that I have. Prepare your questions. If you are not feeling well enough, bring someone with you to
Mhm.
advocate for yourself. And I know right now with a pandemic, it's kind of hard to bring someone else with you, but write them down, write your notes down, maybe call them while you're in the office with the doctor. And also, once you get the treatments and you ask all the questions and you're part of that treatment and you and your doctor decide what treatment plan you're going to get,
Mhm.
then adhere to those treatments, which means take the treatments the way the doctor indicated. Now, we are not doctors, we are not nurses, and the tips and advice that we are giving you are basically things that we have learned throughout our journeys. And
Right.
by no means do we tell you this is what you need to do, this is how you should treat your condition, or otherwise. I want to let you know we are just here to simply support you and bring the information to you. But
Right.
for any disease specific questions, concerns, treatments, please go to your doctor and to your to your healthcare professionals for that. So we want to make sure that we give that disclosure. And again, if you're just tuning in, we are celebrating National Patient Advocacy Day, August 19th. I am Estela Mata, and this is Juana Mata, my sister. We are ambassadors of hope for Mata advocacy and support. And we're also support group facilitators and healthcare advocates for Looms for Lupus. And we're kind of right now just going over what tips of how to become the best advocate for yourself and your loved one. So another thing that a lot of people don't think about is lifestyle changes and modifications. Learn about what you can do to take control of your life. When we are diagnosed with these conditions, we are more than just our conditions. We can continue to live and thrive despite the conditions that we have. So let's learn about lifestyle changes, make those modifications, learn, and most importantly, seek support, right?
Mhm.
Because
Right.
you are not alone. You're not alone. We are
Nope.
here for you There are so many other advocates and organizations and patient advocacy organizations that are here for you. So that is very, very important. And kind of to summarize what we've been saying about what is a patient advocate, how you can advocate for yourself. Again, kind of like what Melissa said earlier, your voice does matter. Yes, your voice matters and your story matters. So
Yes.
remember, we were talking about being a patient advocate. You could do it from home, right, Juana? You can advocate for yourself at home. If you're not feeling well, if you choose not to travel to an office with your legislators to meet with your local mayor, if you don't feel like going to meet your assembly person or assembly member or your congressional leaders or your state senators, you can do it from the comfort of your home. You can email, right? You can call. You can participate in advocacy day from different organizations. Know that you, as a patient, have rights, right? And you can use your voice and speak up about your rights. This means the right for you to get access to treatments, the right for you to get equitable healthcare access, the right for you to voice your concerns, to understand your treatments, to get your treatments, to feel supported. So if you've ever been denied of care treatments, if you experience any healthcare inequities, if you've been denied care, if anything has stopped you from getting the treatments, maybe cost of treatments, maybe utilizing copay cards that are provided for you to use. Maybe you've had problems using these copay cards and you're not able to cover your whole treatment. Use your voice, share your story, and that way you can make change because your story does matter. So there are different ways that you can do this. There are different organizations, there are different patient advocates that are there for you. So these are just a couple of few organizations that we have here. So one, we started our advocacy efforts at a national level through an organization called Lupus Research Alliance. So those are that's an example of a national disease-specific organization. And what we did with Lupus Research Alliance, and I think maybe you want to share a little bit of that, Juana, our first time that we went to advocacy.
Right. Our first time that we went to advocacy was actually in 2018. I can tell you, for me, at the beginning, I was super nervous. But then I realized that there was many patients that we were there for the same purpose. We were there to not only learn from each other, but come to our legislators to speak about what we needed. We needed not only their support, we needed their voice as well to get the treatment or get the funding to receive more research for treatment for lupus, or actually not even treatment for lupus, it was medication for lupus. And since 2018, I can tell you that, I realized that it wasn't as, I don't want to say as difficult or as, I still get nervous when I do speak with my legislators, but it was an experience. And I learned that all of us have the voice. All of us have the voice and the support to be able to come together and do something that's going to help all of us. So definitely my experience with Lupus Research Alliance in 2018 was great. And that gave me more, I felt more empowered to continue my advocacy. And I can tell you from after Lupus Research Alliance, we have been able, or I have been able to not only do more, but just the feeling of more empowerment to be there, to be present, to represent others that are unable to go in person, or go in person or not go at all, but I'm there to I'm there to be the voice of others.
Yes, and that's an example of a national disease-specific organization. And Lupus Research Alliance is the leading organization in lupus research. And that is one of the reasons why we continue to work with them. So if you or anyone has lupus and would love to advocate or want to learn more about how they can advocate, again, be an advocate doesn't mean you have to fly to Washington, D.C.
Right.
Doesn't mean you have to do anything. You can do it from the comfort of your home. And Lupus Research Alliance has the tools to help you to do that and become a patient advocate yourself.
And now with the pandemic, we learned that we can definitely do a lot more from the comfort of our home. We can do a lot more. There's the Zooms. So yes, we don't like that we have COVID or that COVID started 2 years ago, but we actually like the fact that gave us more opportunities to be able to have those meetings in person, yet from the comfort of our home, and still be able to have our voices heard.
Yeah, and I think that was the silver lining to the pandemic is the fact that we kind of were more innovative and we created ways to amplify our voice despite not being able to go to Washington, D.C. or meet with our legislators in person and utilize that voice of ours, not just for ourselves, but for others. But just really highlighting again, Lupus Research Alliance. If you or anyone that has lupus want to learn more, go to Lupus Research Alliance organization. You could Google them. They have credible, reliable information. And when we met with the legislators, which, by the way, just like professional, like the doctors and your healthcare providers, they also work for you. And guess what? They're people just like us.
Right.
So you can be a patient advocate and go share your story with a group of patient advocates like Lupus Research Alliance, or you can advocate for yourself as well. Now, one of the things that when we went as a group, you have different asks. So kind of like when you go seek a doctor, when you go to your doctor's appointment and you want to seek care, you want to ask them for care, right? For treatments.
Right.
When we went with Lupus Research Alliance, our asks were about funding for research. We learned about that there's funding under the Department of Defense for lupus research. We learned that there is funding for the National Institutes of Health, and we advocated to increase that. Now, looking back in 2009, when Juana was first diagnosed with lupus, there was no FDA-approved treatment for lupus. Fast forward to a lot of advocacy and a lot of advocates and organizations like Lupus Research Alliance. Now we have treatments. Now there's more research that's being done, and better quality of life and options for patients, right? And then together with these patient with these organizations like the Lupus Research Alliance, and you also have now the pharmaceutical company that actually understands that patient advocates play such a huge role in getting the right treatments. And the pharmaceutical companies, which I didn't put on here, and I do want to give a shout out to for actually reaching out to patient advocates like us, like Arenia Pharmaceuticals, who has lupus treatments, to GlaxoSmithKline, who has treatments also for lupus, to Pfizer, to AstraZeneca. I mean, there's just so many that are out there that are actually looking out and helping out the patients. And most of those pharmaceutical companies, I know a lot of people may not like them. They have a bad rep. But let me tell you, there's a lot that they do for patients. There's copay cards that they provide for you to get the treatments. There's so many things that can be done, but let me highlight a couple other organizations. So if you're a patient and want to learn more about how to become a patient advocate, how do you raise your voice at a bigger level, or for you to meet with legislators besides just doing it for yourself, self-advocating for yourself at home, you can actually learn more about these with organizations such as Patients Rising. We actually were part of the inaugural group of patient advocates that graduated from the Patients Rising program. And really what Patients Rising program is, they teach you about policies. They teach you how to be an advocate. They
Mhm.
teach you how to share your story when
Right.
you meet with legislators, and you're able to actually advocate through that group, Patients Rising, where it's not disease specific, where it's multiple diseases. You get to share your story, and they are amazing. We love
Definitely.
Patients Rising. Um,
Mhm.
and like I said, we graduated from there. We got to learn more, even
Mhm.
though we already had experience. We got to learn more on
Right.
how to utilize our voice. And then you have organizations like Melissa Tallworth, our friend that just actually, she's saying, thank you for joining and supporting fibromyalgia advocacy. Yes. So Melissa Talwar is the CEO and president and functional medicine health coach for Support Fibro. And that's another disease specific organization where she actually um, raises awareness, supports, and advocates for those living with fibromyalgia. But she also adds in a different perspective where she herself is a healthcare professional and provides you that extra support that you need.
Right.
Um, and like she said here, our reps like hearing from us. It's the original of the idea of the process, hearing
Mhm.
from your constituents. And for those of you that don't know what a constituent is basically you live in a community and that legislator serves your community. You're
Mhm.
part of their community, so they represent you. And what better way to represent you than to hear about your needs and your story so you can
Mhm.
change policies in the future, because they're the ones that make the policies. They're the ones that will go to DC and advocate for you. So if
Right.
you can't advocate for yourself, get to those that do it for you, right?
Right, definitely. And it's not like you said, our legislators are people just like us, and they're happy to hear our stories. And I truly believe that, with us sharing our stories and letting them know what we're going through, that they're gonna have more information to support what we're asking for or what we're advocating for.
Yes, and then we have the Arthritis Foundation, again, another organization that actually supports. They have, they have so many resources, not just specific to one condition. So they support fibromyalgia, they support rheumatoid arthritis, different types of arthritis. And so it's very, very important. And I actually left a couple out. So I apologize to our friends from iPain, Barbie and Ken. You're amazing advocates, and they also advocate for different diseases and specifically anything and anyone that lives with pain. So shout out to Barbie and Ken. Also, there are organizations like um, IAF, which is Infusion Access Foundation, who also is not specific to one disease, but it's more broad. So if you are a patient advocate and want to share your story, what they do is something unique. They have you record your story, they video it, and they utilize that your story to meet with legislators. So you never have to worry about traveling costs and any of that. And yes, Melissa, thank you. Oh my gosh. How did I forget? This is the fibrofog, but yes, internationalpain.org. So our friends Barbie and Ken, huge patient advocates. Not only do they advocate for themselves, Ken advocates and is a caregiver for Barbie, and they advocate for others with pain. They host, conferences. They provide information. They move policy. They speak with legislators. They represent you. So huge shout out to our friends at ipain.org. And then, of course, we cannot talk about patient advocacy without including mypatientsrights.org, which is also a friend of ours that runs this organization and that founded this organization, Liz Helms. She became a patient advocate also, kind of like Juana, where she needed the treatments and she wasn't covered. She was denied access to those treatments. So her story, and she actually has a book and wrote a book about this, and we shared it during our wellness event in May, and a couple of you got her book, autographed book. But My Patients' Rights is an organization that supports your rights. They actually have resources for patients about, the terminology, like what is a copay, what is insurance, what is a deductible, and all of that. So we work very closely with My Patients' Rights. And I will tell you, right now, we're working with so many organizations that obviously I couldn't put them here. And we love and support all of them. But the most important thing is collaboration. You
Right.
cannot do anything alone.
No.
You are not alone. That's why we are here. That's why we collaborate with all these other organizations. We applaud them, we celebrate them. And that's what it's about. Today, we celebrate all the patient advocates that are out there. We celebrate those that continue to do the work for others, those that advocate for themselves, for their loved ones. The one thing that I have to say is these are a couple of pictures where that I share different experiences. Up
Mhm.
above, the first one is Lupus Research Alliance. It's a group of advocates that we've been, together advocating for lupus funding. And, we've gone a long way. You'll see, a couple of familiar faces, our friend Nicole Fogel, our amazing friend Molly McCabe. There I am, there's Juana. There's so many
Right.
people here that we are still connected with. We advocate together, we support one another, we're friends on Facebook, we're far away from each other, but we know how to support each other. And so there's a
Right.
group, and
Mhm.
and I just have to highlight little Meredith right there in the front. She is a patient advocate at such a young age because she also
Mhm.
lives with lupus. So just wanted to highlight there. And we met her amazing mom that's right above her. And she advocates for her daughter. So it's so important to teach our young ones as well on how to advocate for themselves, how to learn how to advocate, and what their rights are. And that's exactly what I did when we went first to advocacy in 2018, right, sister? Like Juana said, you
Right.
felt empowered, right? You felt
Right.
like, oh my gosh, we can do this. Like these people, these
Yeah.
legislators are just like
They're
us.
hearing us. Yes, definitely the empowerment that we feel, and realizing that not only are they people just like us, but they're also hearing us and helping us, trying to help us. So definitely, yeah, the empowerment was amazing. The just empowerment with all the advocates and knowing that these legislators are hearing us.
Yes. And, also remembering that, when one of us or a loved one or a family member gets diagnosed with a chronic condition or autoimmune condition that is life threatening or long term, it affects family members. So it's so important for us to also be aware and support one
Right.
another. And so, right after our advocacy day, we learned as much as we could. We were like little sponges. And then down in the picture, diagonal, the other group of people is the amazing group of patient advocates for fibromyalgia, which were led by Melissa Talwar, and with International Support Fibromyalgia Network. And what she did is she wanted to also amplify the patient's voice, also request funding, to be increased for fibromyalgia. There's so many of us that live with fibromyalgia, and we don't have a lot of representation. And a lot of people don't realize how much research we need. So funding was at like really low, I think. And remind me if I'm wrong, Melissa, if you're still there. It was like at really low, like at 12,000, and it was even decreasing. So what we did is Melissa took a chance on me and she said, hey, I have an idea. We want to advocate in DC. We've never done it before. You've done it. Can you help? And I said, yes, I can. Because we knew that, we could do this. We had done this. We knew that we could not only, and this is where the ripple effect comes in. The things that you do for yourself you can teach others. So keep it going. And so it was at 14 million, and they were going to decrease it to 12 million. So what Melissa did is she put advocates from all over, different states, from everywhere. She scheduled all these meetings. She said, can you help me train the advocates and how to share their story? We've never done this before. And I said, sure. Not only that, but can my daughters come? Because my daughter lives with fibromyalgia. Can my sister come? She also is a patient advocate. So we went as a family. And if you see down here, you'll see underneath the picture where you can see the Capitol, there's 4 of us. So it's my sister Juana, so you're there, my
Yes.
daughters, Cassidy and Isabella, and it was their first time advocating, and we went to DC, and it's so powerful. And
Yeah.
I try not to tear up when I see this, but to be able to teach others what I had learned, what my daughters had seen since 2009. They grew up hearing about advocacy, hearing about getting the right treatments, making sure your voice was heard. My daughter at the age of 13 was diagnosed with fibromyalgia. And even the doctors were impressed because she knew how to go in there and tell the doctors, this is what I've been experiencing. This is the pain that I've had. This is how it's impacting my daily life. This is how, when it gets better, this is when it gets worse. And they're like thinking I'm coaching her. No, these are things she learned from her aunt, from my sister,
Right.
from other patients, from ourselves. So she got an early diagnosis because she learned how to advocate for herself. Self advocacy is the key. So proud mom moment there, because I was able to take my daughters. And then there's another picture of Representative Deloro, who leads the healthcare. She's like the pioneer, the main person up there making some policy changes, and actually learned from one of our friends, Peter Morley, who is an amazing national patient advocate. And he is one that you might want to follow and research. He does this all on his own, and he meets with different representatives. And what he told me is, I said, what is your trick? Like, how do you get all these meetings to happen, to people to listen to you, your legislators? Like, we can't even meet with so many when we go to DC. And he says, you just make it happen. You believe that you can make a difference, and you share those patient stories, and patients trust you. And in turn, you share their story. And he was telling me an amazing story about Rep Deloro, is that from where she's from, that's where they make the Pez candy, the little candy. And he's like, if you go to her office, you'll see something that I gifted. And it's one of those amazing things, is building that trust, building that relationship, having that communication with your doctors, with your family, with yourself, to legislators, to sharing your story, to making that difference that can help not just yourself but others, is pretty amazing. So that's Rep Deloro, and we're there with her, and she was amazing. She has purple hair, so she's fun. Her and Melissa can rock the purple hair. And then also in the middle, like towards the top, get to know your legislators. So get to know your local legislators, get to know your representatives. So your mayor, go to those meetings in your community, let them know what is important to you. Also meet with your assembly members, get to know them, meet your local state senators. We have here a picture with our local state senator. We have a picture up here with our Congresswoman, Grace Napolitano, who has been super amazing. Actually supports us so much when it comes to lupus, fibromyalgia, mental health, and everything else. Always very welcoming, always very supportive, her and her staff. And right underneath that, you'll see a picture of a Zoom activity. So yes, you can advocate from Zoom via your home, via the comfort of your home. And that is a picture of a policy staff member from Grace Napolitano, Congresswoman Grace Napolitano's office, our amazing, I want to call him friend, because we have built a relationship, and we can call him, and he is there to listen to us and to support us. And he's in DC, and his name is Joseph Ciccone. Shout out to all of the staff members, for all the legislators, because your work means the world to us. You are the ones that are making sure that our stories are heard, and that our legislators and our representatives get to hear our stories, and you help move that needle that we need sometimes to be done. So shout out to, again, all of those health policy experts that are there working with our leaders, and also the staffers, right? Because it's been amazing. So it's so, I know it's almost like top of the hour. It's almost 10 o'clock. We've talked so much about advocacy, what it means. And Melissa says, yes, the Mata family does amazing work. Thank you, Melissa. You do too. And congratulations for all the work you're doing. So many patient advocates are doing a lot of work, and that are not even highlighted, that don't do it to get these accolades, that don't do it to get recognition. Melissa Tawar is one of those. We love to work with people like that, people like Barbie, people like Crystal Kent from fibromyalgia, and I know I'm missing so many others, patient advocates. But most importantly, again, I want you to know and leave you with this: your story matters.
Yes.
You matter. Share your story. If you have had any issues right now, we're working on an initiative on copay accumulators and copay cards. So if you have not being able to use those copay cards, please reach out to us, share your story. It could be, in private, we can amplify your voice. We want to make sure that you're getting the treatments that you need. If you are going through step therapy, or the doctor, they're requesting, or your insurance wants you to go through what we call fail first approach, and try other treatments because they don't want to cover a specific treatment that you've been on, then works for you and may actually digress your disease. Let us know. If you have experienced any lack of care, or you've been refused care, let us know. Your voice does matter. And reach out to us. We are on every social media platform. We also have a website, loomsforlupus.org, and mataadvocacyandsupport.com. Please reach out. Let us know how we can help you. Again, it's been an honor not only to be here today with you, celebrating National Patient Advocacy Day, but also sharing our journeys as patient advocates, and empowering you and how to become a patient advocate yourself, and be able to provide that self advocacy that you need, to get the treatment that you deserve.
Right.
Any final words, Juana?
No, I just want to remember everyone that you're not alone, that our voice matters, and let's share our story to get, the what we need, whether it's care, medication, but sharing our story is important.
Be the change that you want to be. Make the changes possible.
Right.
Again, we are important. We matter. Your story matters. Your voice
Yes.
matters. And if you
Yes.
want us to amplify your voice, we are here to do that. So again, happy National Patient Advocacy Day. Empowerment to all of you. Hugs, and I hope you have a wonderful weekend. And with this, we say see you later, because you will be hearing more about a lot of other efforts that we're doing to amplify your voice and to support you. And thank you again from Mata Advocacy and Support and Looms for Lupus. And please have a great weekend.